I am 39 years old, born and raised here in the city of Savannah, Georgia. For me, music, it takes me to another place, a place of hope. It takes you where heartache and pain can be healed. My name is Salathiel, and I have been diagnosed with lupus. I awoke preparing to go to work, and I fell to the ground instead of being able to walk on my own 2 feet because they were swollen.
Lupus is a chronic autoimmune disease that can attack virtually every system in the body. Every organ system in the body can be affected.
And my parents, they rushed me to the emergency room.
Patients can present with a variety of clinical features. They can have things like rashes. This can especially be a red rash across the nose in the shape of a butterfly. They can have headaches, hair loss, sores in the mouth, joint pain, arthritis, blood clots, inflammation in the kidneys, heart, or lungs, or neurologic problems like seizures. If a patient has typically 3 or more findings of those, along with certain blood tests, they can be diagnosed with lupus. There is one blood test called an ANA, or anti-nuclear antibody, which all lupus patients will have.
After the test, I was diagnosed with lupus at the age of 17, and I have this lupus systemic. It affects all of my joints and all of my organs.
There's 2 primary forms of lupus. The first one is systemic lupus, also known as systemic lupus erythematosus, or SLE for short. The other form would be when it's limited to the skin, and that's called cutaneous lupus. Risk factors for lupus include, first of all, being female. It's much more common in women than men, probably because of genetic factors as well as estrogen, but we really don't know for sure. You also see higher rates of lupus in women of color and women of childbearing age, so that would be about 15 to 44. It's important that lupus is diagnosed early because a lot of the damage that can happen with lupus can occur without symptoms, especially the kidney disease.
When I was diagnosed with lupus, I was required to stay in the hospital for about a month. I experienced a moment of flatlining. And with that flatline, they began to do different procedures on my body, and that was how they discovered that my kidneys were actually failing. The peace that I felt in that moment, I was okay with transitioning. I had a beautiful, beautiful experience of encountering my grandparents, and they told me that it wasn't time, that there was still work that I had to do here on earth, people that I was supposed to help in life as a result of being diagnosed with lupus. And it was an amazing experience to have. After I was released from the hospital, I began to experience pain in my extremities, and I went to my physician and he increased my medication. With my medication being increased, I lost all functionality of my body. I was unable to do anything for myself.
The treatment of lupus generally consists of oral medications that patients take. We're all trying to minimize toxicity related to the medications.
My parents then became my live-in carekeepers.
I took half of the year off from teaching just to be her aide. I literally had to take her pick her up from the bed and take her to the restroom back and forth, and literally bring her food to eat so that she can maintain herself.
As I regained my strength with the help of my parents, I was finally able to return back to work. It was an awesome feeling to be able to get back to what I considered my normal life. But the reality was I was creating a new normal.
Patients with lupus can have flares, and this is a time when their disease becomes more active. Some of them may just have worse arthritis or worse rash, but this can also include more serious problems like organ failure of the kidneys, problems with their heart or lungs, blood clots, seizures, and then it can sort of go into remission for a time.
I experienced what we call brain fog, not being able to remember people's names that I've known for years. So there are days when I feel as if I am drowning because of the lupus affecting my lungs, and I have to literally just stop everything that I'm doing.
And lupus is more common if those patients have had other people in their family have lupus. So there is a genetic factor as well.
I think that we should probably consider some topics.
I'm 40 years old and I'm born and raised in Savannah, Georgia. I was a respiratory therapist before I got on disability for this disease.
Of course.
My name is Carell, and I am Salathiel's cousin, and I have been diagnosed with lupus.
Within my family, there are a total of 5 of us that have been diagnosed with lupus. We are all females, and there's nothing like the strength and the power of women.
My sister, she started getting spots on her face, and then I had a cousin who started having heart conditions. It affected me with my lungs, and because of it, I had to have a double lung transplant. So it was really scary, not knowing, whether I was going to come out alive or, what was going to be next for me. But I made it through it, so I'm just grateful for that.
We were able to use our sicknesses to encourage each other, to motivate.
Unfortunately, there is no cure for lupus, but medications have advanced quite a bit. The goals of treatment of lupus are to help the disease be in remission or low disease activity, and we want to prevent organ damage as well. The most exciting therapy I've seen lately is something called CAR T-cell therapy. They've taken a few patients with lupus and genetically modified their T cells and injected them back into them, and these patients have gone on to long-term remission. Lifestyle modifications are highly important as well. They're not getting too much sunlight, which could make their lupus worse, not smoking, and maintaining a healthy weight with diet and exercise.
I believe that my grandparents encouraged me to go down this path because I was diagnosed with lupus for a purpose. And that purpose is to help other people. All my life, I want other lupus patients to know that there is a community of people that surrounds them and that we are here and able to assist them on their journey. As a result of me being diagnosed with lupus, I have been afforded some amazing opportunities to advocate for lupus patients here in the city, all around the world. And with that advocating, I had the beauty of meeting the organization of Lupus Research Alliance. I've been afforded the opportunity to be a co-chair on the Project Change. Project Change stands for everything that I want to see. I want to see change in the lupus community. I want resources to be brought. I want to make sure that all lupus patients are receiving equal care and the things that they need are made available to them. You are listening to The Light, Lupus, and I, where I am your host, Salathiel Deloach. Let's get into it. My podcast name is The Light, Lupus, and I. Let's do this. And it taught me that it was okay to tell my story. It gave me opportunity to allow other lupus patients to tell me their story. And I thank the Lord I'm still alive. I have gathered a group of lupus patients, members of my family, and we are going to go to one of our local parks. And we are going to lace up for lupus awareness here in the city of Savannah. Foundation.
It's very important that a patient sees their doctor regularly, gets their labs to monitor their disease, and takes their medication as prescribed. There's a lot of hope for the future, and our treatments work quite well the majority of the time.
Yes, I'm hopeful, and as you can see by her exuberance about life, that she is going to be successful in whatever she does. She just grabs hold and she doesn't let go until it's finished.
I'm hopeful for the future for all of us. I'm just, thank God for placing each other in our lives. So I'm just grateful.
The greatest thing that I want lupus patients to know is that there is life after the diagnosis. I was diagnosed 21 years ago, and I am still here, still serving, still honoring God with my life. Choose life.